My name is Ann Doe. I am the Executive Director at Planned Parenthood Advocates of Oregon. First and foremost, everyone must know this. Regardless of the Supreme Court's decision, abortion is still legal in Oregon. If you have an appointment, keep it. If you need an appointment, go to abortionfinder.org to find care. The Supreme Court has overturned Roe versus Wade and nearly 50 years of precedent, eliminating the federal constitutional right to abortion and opening the floodgates for states to ban abortion. They have failed this country. The court is stealing our power to control our own bodies, our lives, and personal medical decisions, and handing that over to politicians. We're here today as leading advocates and funders for reproductive rights and justice, and as advisors on the Reproductive Health Equity Fund, which is administered by Seating Justice. We believe that your human right to self-determine your own body and life and future begins with your right to make decisions over your own body. The reproductive justice is inextricably entwined with racial, gender, and economic justice, that abortion is healthcare, that healthcare is a human right, that this court cannot and will not have the final say over our bodies, our lives, and our futures. We have been preparing for this moment. This fund will provide meaningful and urgent support to patients and to the incredible providers and health centers tirelessly working to meet the challenges of this moment and in the devastating wake of this decision. It is also our opportunity for our movement to build the future we want to see for all our communities, one that leads and centers those who will be the most impacted by the overturning of Roe, which we know from the fallout of abortion bans in states like Texas and Oklahoma will be Black, Latinx, Indigenous, and other people of color because of this country's legacy of racism and discrimination. This is the driving force behind our collective work, to dismantle racist systems of oppression that deny communities the opportunity to have their reproductive health needs met. We are fortunate to be joined today by Sandy Chung, the Executive Director of the ACLU of Oregon, who can speak more to what today's SCOTUS decision means. I see raised hands. We're going to have organizations speak first, and then we'll do a moderated Q&A. So we'll be sure to answer your questions, but we're gonna hand it over to Sandy Chung from the ACLU now.
Good morning, everyone. My name is Sandy Chung. My pronouns are she and her. I'm the Executive Director of the ACLU of Oregon. The ACLU of Oregon is a nonpartisan nonprofit organization consisting of more than 28,000 members statewide, dedicated to protecting the principles of freedom, equality, and justice set forth in the Oregon and US constitutions and in our civil rights laws. For almost 50 years, since Roe versus Wade was decided in January of 1973, the constitutional right to an abortion was recognized by the US Supreme Court and was the law of the land. Today, with its decision in Dobbs v. Jackson Women's Health Organization, the US Supreme Court has overturned Roe v. Wade and taken away our federal constitutional right to abortion. This decision will allow extremists across the country to ban abortion and force women and others who can become pregnant into a second-class status by denying them control over their bodies and their futures. This decision is an unprecedented attack on the rights of women and other people who can get pregnant. No one should be forced to carry a pregnancy against their will and face the life-altering consequences of being denied essential healthcare. This decision may inconvenience people with money and power, but people with money and power will be able to continue accessing abortion care for themselves and their spouses, children, and significant others. This decision will most harm communities with the least access to financial and health resources, including Black, Indigenous, and people of color, low-income and rural communities, young people, immigrants, disabled people, and victims and survivors of sexual assault and domestic abuse. Ann Doe, the Executive Director of Planned Parenthood Advocates, already stated this, but I want to state this because this must be clear for everyone across Oregon. Even with today's Supreme Court decision, abortion is safe and legal in Oregon. This is because Oregonians advocated passionately and continuously for abortion and reproductive justice. This means that abortion, contraceptives, and gender-affirming healthcare services remain legal and available in our state. So again, abortion is legal and safe in Oregon. But this is not the same case in other states. With a Dobbs decision, approximately half the states in our nation are expected to ban or severely restrict abortion, denying 36 million people who can become pregnant the fundamental right to decide for themselves if and when to have a child. One of these states is Idaho, our neighbor. They have a law that will severely limit abortions starting within 30 days of today's decision. In states that ban or severely restrict abortion, some people will be forced to self-manage abortions, for example, with abortion medications that are currently available. Others will be forced to travel to states that allow abortions, and others still will be forced to carry their pregnancies, forced by their governments, oftentimes because of laws passed by predominantly male legislatures. In some states, people who have abortions or miscarriages may even be criminally prosecuted. And we've also seen other states pass laws that will allow people to be legally harassed and penalized for helping their patients, loved ones, and community members access an abortion. The decision today is oppressive, dangerous, and undemocratic. It repudiates our country's founding principles of life, liberty, and the pursuit of happiness, and the fundamental constitutional rights of equal treatment, right to privacy, and the separation of church and state. A threat to bodily autonomy and the rights of pregnant people is a threat to us all. It is no accident that state legislatures and school boards across the nation have been escalating their attacks, not just on abortion rights, but on the rights of the LGBTQ+ community, particularly the transgender and gender non-binary community. These same extremists have come after voting rights and also come after racial justice work. These attacks on democracy, racial justice, and bodily autonomy target the same communities. This is how systemic racism, misogyny, and oppression works, by taking away freedom, equality, and political power from historically disenfranchised communities. Fannie Lou Hamer is a great civil rights leader whose own bodily autonomy was violated when a white doctor performed a hysterectomy on her without her consent. We remember her prescient words, "Nobody's free until everybody's free." The ACLU of Oregon and our partners here today will never stop fighting for the bodily autonomy of all people. We ask you to continue fighting with us. Next, I would like to introduce you to Christel Allen, Executive Director of Pro-Choice Oregon.
Good morning, everyone. My name is Christel Allen. I am the Executive Director of Pro-Choice Oregon, and I use she, her pronouns. For the last 45 years, with the support of activists from across the state, Pro-Choice Oregon has led the political arm of Oregon's pro-choice movement for the last 45 years. Today, for people in Oregon, it is important to know that abortion, contraceptives, and gender-affirming care remains legal and available in our state. This is thanks to decades of movement building work. Oregon codified the right to an abortion into state law with the passage of the Reproductive Health Equity Act of 2017. We continue to be recognized as a state for having the fewest abortion restrictions of any state and for expanding care to those formerly denied due to immigration status or gender identity. As advocates for health equity, our coalition here today recognizes that rights are not rights unless you can afford to access them. And until reproductive and gender-affirming care is available to all people in Oregon, free of cost, barriers, burden, or stigma, our work is not done. This decision is devastating, and the impact will be unprecedented. We also know that people's lives do not stop at borders, and Oregonians will not be immune from the harm that has been caused by the Supreme Court's decision. With our partners, we will be doing everything we can to mitigate the fallout from bans in neighboring states like Idaho. And earlier this year, advocates on this call urged our state elected champions to act. Our concerns were heard, and the Oregon legislature allocated an initial $15 million to Seating Justice to create the Reproductive Health Equity Fund, a new model for community-based investment that has inspired other states to follow Oregon's lead. Because of this, we will be able to better address the urgent needs of this current crisis and be able to plant the seeds of growing a more just, a more free, and a more equitable Oregon. Make no mistake, abortion bans are racist, sexist, and classist, and intentionally designed to control the lives and bodies of people who can become pregnant in this country. Like me, there are millions of people who were born after Roe versus Wade was the law of the land. The road ahead will not be easy. Our nation has never lost a constitutional right. So today, I'm also asking for young people across Oregon to join this fight with us. You will be among the most impacted, and we need to hear your voices. For more on the Reproductive Health Equity Fund, I would like to now introduce Siadam Edmo, Executive Director of Seating Justice.
Thanks, Christel. Good morning. My name is Siadam Edmo. I'm Shoshone Bannock Nez Person Yakima. I use she, her pronouns, and I serve as the Executive Director of Seating Justice. Seating Justice is the region's leading funder of groups fighting for racial and social justice. Founded 46 years ago, we've been mobilizing resources and building collective power in our communities through participatory grant making and donor organizing. We all know the Supreme Court decision today will have profound impacts throughout the nation, including on communities here in Oregon. We know those closest to the pain of injustice are also the same people who already experience discriminatory barriers to abortion care. Our rural, tribal, undocumented communities, our communities of color, and folks who are Two-Spirit and LGBTQIA will be the ones who will shoulder the biggest burden from the loss of federal protection for the right to abortion. In March of this year, as many of you know, the Oregon legislature allocated $15 million to create the Reproductive Health Equity Fund, which will be administered by Seating Justice. We are grateful to live in a state that has prioritized access to reproductive health care for everyone who needs it. This fund is one way that our state is boldly protecting and fulfilling reproductive rights, prioritizing work to address the historical exclusions of marginalized communities, and building a more just and equitable healthcare system for all. I'm here today as a funder and an advocate to reaffirm to folks who call Oregon home that this fund has been created to ensure everyone gets the reproductive and abortion care they need when and where they need it. This moment calls for us to join together in our collective power to protect the dignity and self-determination of our communities. This is your fund, and I want to share this promise with you. We will work with our communities to guide decisions about this fund. We trust that you know your reproductive health needs best, and those most impacted by reproductive oppression, including providers of care, will lead decision-making to invest these resources. While $15 million is a strong foundation that will allow us to be responsive to our communities, we also know that needs will only continue to deepen. I'm therefore here to announce that the Reproductive Health Equity Fund is open to receive additional donations. We call on individual contributors and the philanthropic community to help us grow the fund and maximize our reach and impact. We must work together to meet the increased need for access to abortion services in the region and simultaneously break down longstanding barriers to reproductive and gender-affirming care. We believe our best path forward is built on a more just and equitable healthcare system that can support us all, a system that values our dignity, our autonomy, and our freedom to determine our own futures. This moment also calls for urgent action. Today, I'm honored to also announce that the Reproductive Health Equity Fund, along with advisors folks from the provider community and community leaders will grant the first $1 million to the Northwest Abortion Access Fund as soon as the funds are released to Seating Justice by the state. The Northwest Abortion Access Fund is an organization that provides folks in Oregon and beyond with resources and support so they can access abortion care with respect, dignity, and compassion. Before I turn it over to a representative from the Northwest Abortion Access Fund, I also want to share a few critical updates about the grant-making process to ensure our communities know what comes next. As soon as funds are released to us, we're prepared to quickly get resources into our communities. We're awarding the first dollars to an organization that already supports patients in Oregon in need of timely access to abortion. Once these funds are distributed, we'll continue to move the grant-making process forward, work that started in March. The next round of funding will be dispersed via community-grounded grant-making decision process to a wide range of organizations that have been working for years to expand equitable access to reproductive health services in Oregon. We expect the fund to open to others later this year, after criteria is established by a steering committee in consultation with communities. I'll be happy to talk more about our community-driven process and how we will take what we learn and do our very best to turn it into meaningful actions that support providers in our communities later. But now I'll turn it over to Megan Kovacs, board member of the Northwest Abortion Access Fund, who will talk more about the critical role they play in support of people in Oregon.
Thank you so much, Siadam. I'm devastated to be here this morning, but I am grateful to be in community with such incredible advocates and organizations who understand that this is the fight of our lives. I'm Megan Kovacs. As Siadam said, I am a board member for the Northwest Abortion Access Fund. We are the only abortion fund serving Oregon, Washington, Idaho, and Alaska. We have trained, compassionate volunteer advocates who run our toll-free hotline. We help people pay for their abortion care and their travel. We pay for the cost of their abortions. We help people get to and from the clinic, and we make sure people traveling for care have a safe place to stay. The Northwest Abortion Access Fund envisions a world where all people have the power and resources to care for and affirm their bodies, identities, and health for themselves and their families in all areas of their lives. As others have stated before me, this Supreme Court decision is devastating. It will have the biggest impact on people from historically excluded communities. Black families, Indigenous families, Latinx people, poor people, LGBTQIA people, people from rural communities, and young people. But we know that these new resources, this incredible investment into abortion access and care, are critical and urgently needed. And we know this because we are already seeing it. Our organization is on the front line of supporting people who need reproductive health care and are struggling to get their needs met. Recently, while I was on the hotline, we've provided support for a mom from rural Oregon who'd had to travel over 5 hours and take a day and a half off work just to get an abortion so she could better care for her family. As we know, 60% of people who access abortion are already parents. I worked with a young person who was incarcerated and needed to pay for the cost of their travel to and from their appointment, including the time for their correctional officer to drive them to and from their abortion appointment. This person had to wait so long to coordinate care that they ended up needing a much more expensive abortion procedure later in their pregnancy. Access is not access if you cannot afford it or you cannot get to your appointment. That is what abortion funds are for. That is what the Northwest Abortion Access Fund is for. We are here to make sure that we can support the people who need access to abortion services, but do not have the means to pay for it or their travel themselves. People are already experiencing harm and have been before this decision as a result of oppressive restrictions and bans that have already been in place. Now that this decision has happened, we know that it's only going to get worse. We have already seen a 78% increase in the need for abortion funding from 2020 to 2021. Travel needs doubled from 2020 to 2021. Last year, we gave out over $800,000 to help people pay for their abortions and travel to their appointments. We expect these trends not only to continue, but to accelerate after today's decision, which is why this $1 million grant from the Oregon Reproductive Health Equity Fund is so urgently needed. Now is the time to strengthen resources and supports as the landscape shifts and people become increasingly impacted by a loss of abortion care. This investment is transformational in creating the infrastructure needed to continue to fund people's abortions. We are grateful to be part of a community and a coalition that understands the necessity of supporting those who will experience the greatest barriers to access because of this decision. I want to end by reassuring Oregonians that we will continue to prioritize the immediate and urgent patient needs for abortion funds and practical support, which means travel, lodging, et cetera, in the weeks and months ahead. And we are staying focused on our long-term fight for reproductive justice for all. We have been doing this for years. We are ready for this. This is what we do, and we are here for you. I want to now turn it back over to Ando.
Thank you, Megan. Our bodily autonomy is central to our liberation. If our freedom to make decisions about our health and bodies is denied, we as a people are not and cannot be fully equal. We as a community cannot respond to this from a place of fear. We can walk into what we know is coming together and build the future we want. Make no mistake, mitigating the harm that will impact our communities across the nation falls on us. It is time for legally protected, funded, equitable, supported, and destigmatized access to abortion. We believe in a future beyond Roe where every person belongs, has the power to determine their own futures, and has access to the care they need. This decision at its core is about abortion, but the impact will go way beyond abortion. This is about who has power over you, who has the authority to make decisions for you, and who can control your future. What is clear from this opinion is that nothing is safe. This constitutional crisis overturning a right established nearly 50 years ago is a precursor of what's to come. But this is far from over. Generations before us have fought tirelessly to gain and protect the rights we have today. We will not back down. We will not stop fighting until every single person has the power and resources for self-determination. And it has to be all of us. Together, we have the power to stand up, fight back, and reclaim our rights. And we are asking for you to join us. Here are a few opportunities that you can do now to support this critical work. First, donate to the Reproductive Health Equity Fund to ensure that we are funding ways to be able to connect patients with the care that they need and supporting providers and being able to ramp up their capacity to give that care. Show up today at 5 p.m. in Portland at Salmon Street Springs, 5 p.m. in Eugene at the federal courthouse. And I'm sure there are plenty of organic other actions that are happening across the state. So take a look and get out into the streets. And then join us for a day of action on July 9th. You can sign up to take the pledge to act using the link that we're dropping in the chat below. We're going to open this up for Q&A now. And what I'm going to ask for folks to do is to please raise your hand and we will call on and unmute you. And as a reminder, we're asking folks to limit themselves to one question. For any additional or follow-up questions, those can be emailed to Rose King, who will connect you all with the appropriate folks. So I'm going to just go ahead and take a look at the queue. It says, looks like the first person is K2 News. And for folks, please rename yourselves with your name and your media outlet just to help us.
Hi there, Anne. This is Megan Allison with K2. I know that your team has talked about potentially spiking demand in the weeks and months ahead. How have you managed resources to prepare for that?
Specifically, so Planned Parenthood Advocates of Oregon is the political and advocacy arm for our healthcare affiliates. I would encourage you to actually go to the virtual press conference that our health affiliates will be holding at 1 p.m. So that they can speak more precisely to that, since they've been at the forefront of operations. But I will say that they've been preparing for this for a very long time to try to increase capacity, but they'll give you more details at that press conference. Alex.
Hi, yeah, thank you. I was curious, I have a question, I guess, for Siadam. I'm curious, you mentioned that you're waiting to receive funds from the state still. Do you have any idea as when that funding will come through, so it can pass along to the Abortion Access Fund and other community funds?
Thanks, Alex. We're expecting that should be fairly soon. I imagine within the next month or two. And our experience with funding that comes from the state is that pretty quickly after things are finalized, that money becomes available. So we're hopeful that it will be in the next month.
Christine.
Can you hear me? Okay, perfect. I was unmuted. Thank you for having us. And you may refer me to the other press conference you actually previously mentioned, but I'll ask anyway in case you know the answer. I understand Planned Parenthood is renting medical office space on the Oregon-Idaho border. Do you by chance know what the plans for that location might be? Will it be a place where people in Idaho can travel to get abortions?
Yeah, I'd again, you knew what I was going to say. I would encourage you to attend the press conference that Planned Parenthood Health Centers, and you'll see me again, you'll see me twice today, will be holding at 1 p.m. today. That press release and invitation for folks to register should be going out shortly. Thanks, Christine. Julia. We can hear you now, I think. Unless you're speaking and we can't hear you. So while Julia is sorting out tech, are there others that have questions that we can direct to the speakers?
I do.
Is that you, Julia? Can we hear you?
No, Lynn Terry here. She's my colleague. I don't know why my hand's not showing, but anyway.
I think you're labeled as Julia. That's why it's hard for us to, we don't know who you are. So Lynn, are you're Julia? Okay.
Yeah. Lynn Terry with the Oregon Capitol Chronicle. Sorry, she sent me the link because I didn't get it. Anyway, just one little thing. If you could provide an email, you asked for contributions, it would be helpful for us writing about this to include an email or where people can contribute. That's not my question though. My question is, you mentioned this is a precursor of things to come. I'm just wondering, I know it's early days yet, but if there's thoughts of perhaps expanding the fund or preparations for potential barriers to gender affirming care or other rights that you fear might get overturned by this court?
Yeah, I can start with an answer, but then I invite Sandy and Christel to join. I think that if we have learned anything from the past 6 years, it's that we cannot take anything for granted and we cannot rest on our laurels. And so we need to continue to assure that Oregon remains a place where people can access the care they need when they need it, where they need it. And we will be tireless in seeking out those answers and those protections and that expansion through, legislative work group with the Speaker's office, as well as doing a lot of coordination with advocates both in the state and across the nation. And I'll let Sandy and Christel join in with their answers too.
Yeah, I mean, I think one of the things that is the reason why Oregon is just feeling a little bit prepared today for this devastating news is that we've always taken this issue incredibly seriously at the state and local level. That's thanks to generations of people working to build and sustain this movement. And this work is completely shifting to the states. And so, we want to just again emphasize that Oregon will not be immune to these impacts. We are expecting an estimated 235% increase in people traveling to the state. We also know that we're going to see people in Eastern Oregon lose access. And so really making sure that we are coordinated as a state, that we're working together across all levels has never been more important. And it's never been, more possible to get involved in this work at the local level. So in addition to working much more closely with our local leaders over the next few months, we're also going to be, making sure that we're asking folks at home listening to get involved, and you can get involved in any community, including at 5 or 5:30 today, showing up at your local courthouse. So thanks, Terry, and I'll pass it to Sandy.
Thank you, Christel. I just want to re-emphasize what Anne and Christel have stated. Although we do have very protective rights in Oregon for abortion access, as well as contraceptives and gender-affirming healthcare services, this could all change with some changes with our elected leaders. And so it is very important that Oregonians continue to engage and continue to fight to protect these fundamental rights in Oregon. And I want to note as well that this is something that we need to focus on in terms of every single elected seat in our state, because we've often seen attacks against bodily autonomy, not just coming from federal legislators or state level leaders, but also at the school board level, when school board members try to take away bodily autonomy rights or the information about that from students at schools. We also have seen in some states efforts to criminalize miscarriages and abortions, and also the doctors and others who help people access them. So then again what's really critical are people in prosecutors' offices, which are elected positions. And so I just want to reemphasize that although we should be very grateful for the work that's already been done, and people in Oregon need to know that abortion is safe and legal and accessible here, we still have to continue fighting really hard to make sure it stays that way.
Thanks for the question, Lynn, and thank you for the responses, Christel and Sandy. Amelia, you can go ahead and go off mute, or we'll unmute you and you can ask your question.
Thanks. I think Oregonians could find themselves very shortly in a position where relatives or friends in Idaho request their assistance obtaining abortions here in Oregon. What do people need to know in terms of the laws taking effect in Idaho immediately or within 30 days, and their legal risk or protection for people in this state who choose to assist others in obtaining abortions here?
I can start. Sandy, do you want to take this to begin? Yeah, that'd be great.
I just want to note this is a really important question, because the ACLU of Oregon, we see the fight to restore the constitutional right to abortion on several levels. First, it's going to be a really long-term fight at the systemic level to make sure that we restore this constitutional right across the United States. But the second level of the fight is a day-to-day fight to engage in harm reduction, meaning that we need to help people across, not just in Oregon, but across the country, have bodily autonomy and be able to access abortion. So mutual aid is critical, and by mutual aid, I mean just helping those who cannot access abortion do so. But the problem is there are states that are trying to criminalize access to abortion, and Idaho is one of them. And the laws and the ways these laws have been written in different states are different. And so one thing that we're really working on, both the ACLU of Oregon with ACLU National and other affiliates and our partners, is we are in the process of analyzing these laws and their potential impacts on people who are helpers here and help people access abortions. I don't have a clear answer for you because although states should really be limited in terms of them not being able to impact people in other states, we are seeing states including language that indicates that they might try to impact people here in Oregon and outside their states who do help people access abortion. And so the legal ramifications still aren't clear, as well as how much these states can do. And so we will be analyzing these laws and sharing basically our guidance and as soon as we can. But I do think people have to be mindful about how they help. I also want to say, I think it's a moral imperative for all of us to do what we can. And so I think some of the things that we can really do is to make sure to give to the reproductive justice, the fund, and support the organizations here that have already been doing the work of helping to create access for abortions. If folks also have specific situations going on, we're also happy to engage with folks directly. And so they can actually email us at intake@aclu-or.org.
Christel, anything else you'd like to add?
I think Sandy covered everything. There are just so many unknowns. And just to emphasize, we don't know what exactly the timeline will be, but Idaho does have a trigger ban in place. And so we do expect it to be one of the states that is first impacted. It's one of 13 states that has a trigger ban in place as of today.
I believe their law goes into effect in 30 days after this ruling. And on the addendum, I will add to Sandy, and what Sandy so eloquently stated is people have been having abortions for as long as they've been getting pregnant, and community has consistently always shown up to be able to facilitate a person's ability to self-determine. And I think that is a spirit that we are carrying forward in this moment in all the ways. And all of the levels, advocacy, political action, in mutual aid, in supporting groups like the Northwest Abortion Access Fund, and in donating to the Reproductive Health Equity Fund. Lisa.
Good morning. Question for either Christel or Sandy, probably. What are the plans if access to clinics becomes physically difficult here by anti-abortion groups through protests or demonstrations? What's looked at being in terms of being able to put something in place?
Oregon does currently have a law that protects access to health centers, but that doesn't preclude protesters from being on the sidewalk in front of and in public spaces in front of the health centers. And so I think thinking about how to strengthen those protections is key. And I'll go ahead and hand it over to Sandy and Christel to add on to that.
Thanks for the question. It's something that we're taking really seriously. We're looking at it at the table of a over 60 person stakeholder work group that has been convened by the Speaker of the Oregon Legislature. This is something that we absolutely have on our radar. And I think there are also things beyond just policy that can be really helpful to ensuring that people feel safe going into community. Earlier this year, with the help of a local artist, Rebecca Cohen, my organization, Pro-Choice Oregon, has been putting, I think, over 200 posters that say abortion is healthcare in storefronts in Portland, downtown Portland, in Salem, and hopefully in Eugene soon. It's reaffirming to patients to know that they are in communities where 70 to 80% of people support and see abortion as healthcare. And so it's a visual representation. And, we also know that the majority of people who harass and protest outside of clinics are by far the minority of people in our state. And so I think it's important to make sure that we are telling that story to people seeking abortion and to the providers that are providing this essential health care.
I want to respond that there isn't a simple solution to people protesting outside clinics. But I also want to note that the First Amendment also does not allow people to threaten people and affect people's safety, right? So that is not covered by the First Amendment. That being said, I think one thing I do want to note is, first, I think a lot of our clinics have asked for folks who support reproductive justice and abortion rights, please don't protest, although you have the right to generally protest in areas, please don't protest outside clinics because that doesn't make that situation safer. So just in terms of practicality, thinking about your impact on people trying to access reproductive services at those clinics. I also want to note it's not a simple answer because it's not simply a case where we can have, say, police officers there, because there are also many communities that access clinics who don't feel safe with police officers. That being said, I do want folks to be really on the lookout for this issue, to be involved, but also make sure to contact your legislators, including prosecutors' offices, because we've also seen that sometimes, although Oregon has created greater laws to try to protect the safety of clinics, those laws are not always implemented in the same ways by all prosecutors' offices. And so I think that's something that we need to be mindful about, that we make sure that all of our electeds are doing what they can to make sure that abortion and other reproductive care services are accessible. And one thing prosecutors can do is to make sure to enforce the laws that Oregonians have passed.
Thank you, Sandy. And I will note that, the Seating Justice crew has been having conversations with providers to talk about what their needs are. And I think safety considerations and facility considerations, of course, are some of the things that have risen to the top. And I do want to echo what Sandy said. There are often protesters at Planned Parenthood health centers, and we know how passionately people feel about wanting to stand up for people's ability to, make medical decisions in privacy and with compassionate providers, but counter protests are not helpful in those contexts. For a patient entering into a health center, all they really see is chaos and loud noises and just conflict. And so we do ask that folks, instead of doing counter protesting, funnel their efforts into volunteering with organizations such as ours, or donating to the health centers, or even becoming a clinic escort. Consider doing that. So we have a little bit of time. I want to see that we have a couple of repeat questions. So I want to first ask if anyone who hasn't had a chance to ask a question yet would like to, and then just pause for a second as we do that. And seeing none, I will go ahead and call on Alex.
Thank you. Yeah, I have a question that I think is probably best for Sandy. It's a little off topic. In a concurrent opinion today, Justice Clarence Thomas mentioned that the court should reconsider same-sex marriage and rulings around that. Is that something that the ACLU is preparing to fight and defend in Oregon? And how are you thinking about that impacting the state?
Alex, the short answer is yes. We cannot feel safe with the rights of any historically disenfranchised community or group in the United States. And although I want to be clear that the DOPS decision today does not directly attack same-sex marriage, it very much feels like, based on the opinions of some of the justices, that some of these, fundamental constitutional rights, the Supreme Court may very well come after. And so we are preparing, but as I stated in my statement, nobody's free until everybody's free. And so I think I want to just impress upon folks in Oregon and elsewhere, don't assume your community is free right now and okay because you haven't been directly targeted yet. What we're seeing is extremists across the country, including in Oregon, have come after transgender people and kids, non-binary folks. With this decision, they're coming after women and other people who can get pregnant. Extremists have also come after Black, Indigenous, and other people of color with attacks on, CRC. They've also come after voting rights. And so I think it's really important to look at the bigger picture. What we're really seeing with the Supreme Court, in my view, is they're destabilizing fundamental columns that hold up our democracy. And so this is really a fight for our democracy. The ACLU of Oregon and ACLU National and all of our affiliates are working very hard to be prepared to fight back, to defend our democracy. But I think defending our democracy fundamentally comes down to us also fighting for each other. And so even if you're not directly part of the transgender community, it's important to fight for the transgender community. Even if you cannot give birth or get pregnant, it's important to fight for people who can get pregnant and give birth. And so we really have to look out for each other. But again, remember, nobody's free until everybody's free, because they're coming after all of us.
Thanks, folks. We're going to have these be the last two questions. And so, Amelia, go ahead and ask yours.
Yeah, can you hear me?
Yes.
Great. So you've had a sort of very clear ask to counter protesters not to show up at clinics or places where patients are receiving care, because it doesn't help. I'm wondering if you have anything to say regarding the sort of recent spate of vandalism and attacks that have targeted both crisis pregnancy centers and some anti-abortion rights political organizations, and if just what you would say about that as a tactic and how it impacts the movement that you've been describing today.
I think that rather than focusing on that, I think what we're focusing on is on care and on people being able to access their right to bodily autonomy, right? And I think that health centers, clinics, abortion providers have been targeted for so long, right? Have literally lost their lives, and there have been explosions and attacks on health centers. And I think that sort of focusing on these discrete instances really distracts from what has been historically a pretty violent pushback on people just providing care or on places providing care. And I think that we just need to remember what has been historically the attacks from anti-abortion extremists that have cost providers their lives. And so I think that, focusing too much on that piece really negates the other pieces.
I'm not asking it not to negate that piece, but I guess I'm wondering, if you are concerned it will escalate violence against providers as well. I guess that's that it creates this sort of retaliatory atmosphere that also, that was where it came from.
Yeah, I understand. K2, this is our final question.
Hi there, thank you. I believe this question would be best for either Seating Justice or the Northwest Abortion Access Fund. And I apologize if I'm making you repeat yourself, but I'm just a little curious about what the timeline will look like for the rollout of this funding. I know that you had mentioned end of the year. It seems like people would be able to access this funding. So what will lead up to that? And I guess what are kind of the next steps that people can expect?
Yeah, that's a really good question. Adam from Seating Justice has a more clear understanding of where the funding is at with OHA and when it will be dispersed. What we are preparing for and what we have been preparing for since we knew that this was coming. Obviously, we all knew that this was coming. We have been preparing to stand up access and to ensure that we can seamlessly continue funding people. So, even before this funding comes in, we have the money to be able to continue funding abortions in the Pacific Northwest and funding travel in the Pacific Northwest. Does that answer your question?
I can add a little too. As soon as the funds are released by the state, we're prepared to quickly get resources to our communities, including fulfilling our commitment to the Northwest Abortion Access Fund. We imagine it will be within a week or so of receiving the funds that we'll be able to get that first investment out to them.
All right. I want to thank you all again so much for being here. I know it's a really dark day, and I think there's no two ways of being able to get around that. It is a dark day. We have heard categorically from our court that they do not believe that we are equal, that we have control over our bodies. But I do think the solace that I am able to have in this moment is that we have the infrastructure here, setting up the infrastructure here through the Reproductive Health Equity Fund to not just meet this moment and the urgent needs of patients and providers, but to actually invest in the healthcare infrastructure and make longer-term investments in workforce, in facilities, and in the infrastructure to close access gaps here in our state, to serve Oregonians who already have to travel hundreds of miles and will have to travel even further as a result of this decision. And so I thank you all for being here and for your questions. And I think we're going to wrap it up now. If you have anything that you would like to follow up with, please email Rose King. I've also dropped the RSVP link in the chat for reporters interested in attending the 1 p.m. virtual press conference with Planned Parenthood Columbia Willamette and Planned Parenthood Southwestern Oregon. You need to email that email address, Christy, to register.